yoga is a very powerful intervention, not just for the physical body, but also for our mental health. So we're going to do some yogic suksham vyayam, which is mostly like a warm-up for the body. So that's why I encourage people to come at sharp at 9 o'clock, or if you can come a few minutes early, you'll get to interact with all the teachers. So we start the session at 9 with little warm-ups. We do some therapeutic yoga in which we move almost every part of the body. Then we'll do some pranayama, some pratyahara practices, which is withdrawal of the senses, which creates a beautiful relaxation response in the body. Then we do some dharana, and then if you're lucky, we'll have some expert meditation teacher with us, lead us into deep meditative practice.
Welcome to India News. Our guest today is Jay Gupta, founder of Yoga Caps and RxRelax. He has taught yoga in New England and across the United States for over 20 years. He has been a permanent fixture at our Health Expos for the last 10 years. This is the 10th anniversary of Health Expo. Jay and his team kicks off the Health Expo every year. This year, he and his team is going to focus on yoga as well, but also mental health. We have seen a massive rise in the mental health among the Indian American community. Recently, we had an Indian American family killed the entire family due to mental health issues. And there have been many other cases as well. Mental health is one issue which is not talked openly in our community. There's a lot of stigma, but this issue must be brought up to the forefront of the community. And with Jay, today we are going to talk about the mental health crisis and how yoga can help relieve that mental health issue. Jay, welcome to our studio.
Thank you.
10 years. Thank you so much for your help and cooperation.
Always a pleasure.
And so this year, as we were talking off the camera, you said that mental health is a big issue. And we did have an incident recently in the Indian American community where a father killed himself, his wife, and a daughter. And a lot of people are saying it was a mental health issue. But there has been a lot of other mental health issues as well. And also social media is also another factor which is compounding the mental health issue. So what is your take on mental health and yoga?
So yoga, as we know, affects our body, but there are a lot of practices which affect our mind as well. That's why I feel yoga becomes a very, very powerful tool in our hands. Our community, Indian community in America, they don't like to go to psychotherapists. There's a stigma against using medication.
Sure.
So there's a lot of stigma about mental health in our community, and it's not openly discussed. But fortunately, we have this powerful tool called yoga. And I can talk forever about what is the mechanism of action, how yoga really helps, not just with the physical body, but also with our other layers of our being.
Why you think and how do you think that yoga can really help with the mental health? What is the direct connection? We'll talk about body later on, but let us start with the mental part.
Well, the way yoga is marketed in modern times is mostly for the physical body, but yoga has a huge mental component. Yoga actually defines the body's anatomy into 5 pieces, and physical body is just one part of it. So Annamaya Kosha, Pranamaya Kosha, and then comes Manomaya Kosha, which is the mental piece. So we have practices which directly affect the Manomaya Kosha, the mind part. So that's why I think it's a very powerful tool, not just for changing the chemicals in the body, make us physically, more active and healthier, but also for the mental health.
Now since you are mentioning, I remember Yoga Vasist, which I am a big fan of that book. And the entire Yoga Vasist actually, it starts with mental health. The god Rama, who became such a powerful, when he was a teenager, he had this mental breakdown. And then Vasistha comes and teaches him all about, nothing was mind. The entire 2 volumes of Yoga Basist is nothing about mind. So of course, and then by treatment, he becomes a god and one of the most famous king, kills Ravana and all this stuff. We all know the story. But even the mental health since that time has been a big part of the system. Somehow it got lost later on in the Indian history because of the pandemic and all again coming back. So give us a few tips about the mental health from the yogic point of view.
So I have not studied Yoga Vasishta the way you have studied.
Sure.
But the brief idea which I understand is the mental health conditions are called Adhi. So AADHI. And the physical body diseases are called Vyadhis. These are real diseases which manifest in the physical body. So if you really look at what is happening in the modern time, the diseases, the root cause, are actually in the Manomaya Kosha. They are in the mind. And then later they manifest in the pranic body and then the physical body. So the progression can take a long time, but if you look at hypertension, diabetes, high cholesterol, weight management, all these issues which are happening in the physical body, they happen much after a lot of abuse with the mind. We live in a society where stress is very common. We accept, we don't even talk about removal of stress. We talk about stress management. So we don't want to manage. We want to manage our money. We want to manage our life, but not the stress. We want to let stress go. How do we do that? Yoga gives us a lot of tools for that. And once we start to attack the root cause of the problem, which is Adhi, a lot of those psychosomatic disorders, we call them, which are Vyadhis we are talking about, they can also be eliminated or reversed.
So those who are going to, so the yoga session will start at 9 o'clock. I know the Health Expo will start at 10 o'clock, but we kick off with yoga 1 hour earlier. And all the people who want to attend, the room becomes full very quickly. So those who are coming, what are the things they should bring to the Health Expo? The first thing is the Health Expo is on August 18th, Sunday, at Burlington Marriott Hotel from 10 a.m. to 4 p.m. But yoga session is started sharp at 9. And you guys already start at 9. So what they should bring with them for the session?
Well, I would say 2 things. One is yoga mat, which is optional. If you don't have a yoga mat, you can always bring a towel or something to lie down. But bring a lot of enthusiasm, because in 2 hours, 9 to 11, we're going to do a lot of these practices which will affect various parts of our being, not just the physical body. I'm a pharmacist by profession, so as a pharmacist, I believe it changes most of the chemicals in the body in a way that we create that homeostasis, we create the balance.
Yeah. And can you give us some sort of a sneak peek view of what people are going to learn there?
Well, I'm expecting at least 2 or 3 more friends with me who are going to be teaching the yoga session with me. And what I would say is, come on over and watch. Come on over, if you want to just come and participate, that will be more powerful than I give a talk about what is happening there. So during the pandemic, I was working with a nonprofit federally qualified health center in New Hampshire. And I had 2 doctorate students who were very interested in studying yoga in trauma. So the population we served there was mostly people experiencing homelessness. So trauma, early childhood traumas are very common, but that's when the pandemic started in 2020. So we changed it around and we did a telehealth yoga intervention for 8 weeks. And the clinical trial was actually administered by Antioch University. And what they monitored was 4 things: depression, anxiety, insomnia, and PTSD, which is post-traumatic stress disorder, and 2 of the PhD students. So what we found was within 8 weeks, it was once a week intervention, 1 hour yoga class. Within 8 weeks, we had statistically significant improvement in all 4 symptoms. So this was a time when healthcare professionals were experiencing a lot of trauma. And we were able to not only just manage it, but reverse it for all 4 symptoms, which is depression, anxiety, sleep issues, mostly insomnia. As part of Yoga Caps mission, we want to bring yoga to underserved populations, so people who cannot or will not do yoga. So we started teaching yoga with oncology in the year 2005. And since then, it has been growing. So about 10 years back, we got an opportunity to serve people who have different abilities. So people with paralysis, people with spinal cord injuries, traumatic brain injuries, multiple sclerosis, Parkinson's. So we started to serve that population. And I would say I've been very blessed that we were able to travel to more than 40 states. Last I counted, it was, I think, 42 or 43 states and Washington, D.C., where we were able to go to different hospital systems, different clinics, medical institutes, and teach yoga in those communities to serve the healthcare professionals, but also bringing yoga to people who are suffering from those different health conditions. As we said, yoga is not just the physical part of the system. It also has a lot of pranic component to improve the energy level in the body and the mental component. So the way we designed our therapeutic yoga program, the people with different abilities, people who don't have use for their legs, who might be on a wheelchair, even they can get full benefit of yoga while seated on their chairs. But when we talk about paralysis or even spinal cord injuries, there are so many different levels. Everybody is very, very different. So if we can create an inclusive program, which we did, everybody can get benefit of yoga.
Also, if you can talk about how important it is to expose children to yoga.
Phenomenal question here. Dalai Lama actually said if we can teach yoga and meditation to little kids, we can change the whole spectrum. We have a lot of clinical data right now which shows that children can benefit so much. Many years back when I was teaching in the school and college systems, I was surprised to learn that a lot of kids nowadays deal with huge amount of anxiety. And with social media grown exponentially now, I think depression, anxiety, and insomnia are big issues in our society. So yoga is a very simple but very powerful tool to mitigate those health conditions.